Hello, everyone. Shall we start?
Yeah.
All right. So Stefan show up too. Nice to see everyone here. Okay, come for that. So anyhow, it's a privilege to actually start this conference, which is the conference called Heal the Earth, Sustainable Development Goals in a Changing World, which is a virtual conference. And the conference itself actually run from June 25th to July 10th of 2020. But in this specific session that we are focusing on is called Beyond Boundaries, COVID-19 and Global Health, which will be moderated by two very cute and good looking and beautiful co-hosts, which is me, Wibool Piyawattanametha, live from Bangkok, Thailand.
And by Velia, Siciliano, live from south of Italy. So welcome everyone and thanks for being here. Today we are launching the first panel of this conference, which is Beyond Boundaries, COVID-19 and Global Health. We believe that this panel really fits the purpose of this conference because the focus of the conference is to exploit the contribution that we as young scientists can give to tackle global challenges. And these include climate change, biodiversity losses, pollution, but also inequality and at social and economical and educational levels. The conference is set through 2 weeks. In the first one, we are going to focus on health and environment, whereas on the second one, we will focus on research, environment, and science communication. But what we'll find out over these 2 weeks is that all these topics are very deeply intertwined. And that's actually what's the beauty of GYA in bringing diversity. This diversity will be critical to find and propose new solutions to improve the health of Earth, of the planet, and of people. So we also know that we should have been all together in the beautiful Kolkata, India, and this was not possible because of COVID-19. And so this pandemic really shows how our action and our poor consideration of the environment and biodiversity in the government's action can have an impact on our planet. And so that's why we decided to dedicate a one panel session to COVID-19 and on its impact on health on a global scale. So today, we are going to have a lot of panelists that will contribute to our discussion. But first, we would like to thank our funding and cooperating partners, which always play a critical role in feedbacking to us and in our choices.
And those are, those are the Leopoldina, German National Academy of Sciences, WHO, right? IAP Inter-Academy Partnership, Gordon and Betty Moore Foundation, Indian Young Academy of Sciences, and Federal Ministry of Education and Research.
Also, we would like to highlight a few of the house rules. We have started recording this session, but most importantly, we really want you to engage. Overall, this hour, we will explain you what will be the topic that we are discussing, how the panel's contribution will have in this discussion. And so you people have all the means to ask questions to us and to the members of the panels through the Zoom chat. Further, we want to engage you also in a more proactive discussion using the Google Doc, whose link has been provided over emails and that you can find also here. That's just a screenshot of how this document look like, and actually we already have some contributions, which is really, really amazing. So we encourage you to find this document and write your input if you have more questions, or if you have any answer to the questions that we have posed already. You can write your name in the contributor section, and then just where you are to the discussion, you can put the initials of your name. And Wibool, this I hand it over to you.
Sure. So to begin the session, we have actually several greetings video from top scientists, actually senior scientists from around the world. But we here, especially in this session, we selected to present you two of the snapshot videos that are actually presented to you. The first one is from President of Brazilian Academy of Sciences. He is also Global Young Academy Advisory Board member. His name is Luis Davidovich. And another person is one a very strong lady from Japan. She's also GYA Advisory Board member. Her name is Yuko Harayama. So we will show these two videos in full link, which is probably take around less than 10 minutes, I guess. And we will go back to the actual panelists and do Q&A later. Shall we start?
Hello, I'm Luis Davidovich, President of the Brazilian Academy of Sciences and member of the Advisory Board of the Global Young Academy. I greet you all, even though unfortunately not presentially, at least using modern technology to talk to you in this way. I want to share with you my worries about the present situation of the world, not only during the pandemics, but also after it. What can we do to help most of humanity, who probably will not have access in a short time to new medicine or to a new vaccine to combat this insidious and invisible enemy? How can we help them? Will the world go back to the situation it had before the pandemics, or will it be a new world? Will humanity still be reluctant to act against climate change, against deforestation, which not only will change climate, but will release new viruses into the civilization? How can we help humanity? And I believe that GYA is specially suited to do this debate, to mobilize people in this direction. So I'm very happy to talk with you. I'm very happy to be a member of the advisory board of the GYA, and I hope we can meet presentially soon. Keep safe, take care, see you soon. Bye-bye.
Hello everyone, this is Yuko Harayama. I would prefer to be in touch with you in person, but today it's almost impossible. Having said that, I'm happy to be with you through this video message. It's the first time that GYA organized its annual general meeting online. It shows GYA's capacity to address unexpected challenges and how innovative is GYA. Today, under the threat of COVID-19, I would like to remind you the meaning of Global Young Academy. First, global. Today, most of the people around the world are under the stay-home order, and they feel isolated. Therefore, we need more than ever to think together and act together. Second, young. Because you are young, you may be inexperienced or immature. But because you're young, you have a huge potential to bring fresh ideas and to change the world. Third Academy, all of you are sharing the value of science. Therefore, all of you are committed to advance science together. All together, it brings us to GYA. Please enjoy being together and let's talk about our future. Thank you.
So I guess everyone, hopefully you enjoy really nice short greeting videos from our board members, and hopefully we'll create lots of thinking and discussion throughout the next 2 days that we're gonna have. Back to you, Velia. Unmute it first.
Okay, do you hear me now?
Okay, good.
Great. You also see me sharing the screen, right?
Yep.
It works, perfect. So here, that's the amazing panel that is joining our discussion. I hope that you had already time to see their videos. And we have a YouTube playlist that is provided for you in the following link. And then we will introduce them one by one, selecting some keynote sentences from their very inspiring videos. So the first one is Clarissa Rios Rojas from the University of Cambridge, who key sentences to us was research coordination is key to help solve both global and local issues. And later we will ask her to elaborate more on this very important concept.
The next one is Meghnad Dimos from Nepal. He's a Chief Research Officer from Health Research Council in Nepal. So he's focused on Nepal, focused on 6T strategy, travel restriction, testing, tracing, tracking, treatment, and together they can come out with this from this pandemic pretty beautifully.
And then we have Huanyu Cheng from the Pennsylvania State University, USA. I really hope I pronounced it well. I'm really sorry if I didn't. But one important message that is sending is that wearable technologies enables rapid vital signs monitoring of patients, which is really important to monitor and track the pandemic.
And one of the next panelist is from Spain. He's an ex-GYA member as well, Toni Gabaldo. So one of the key statements that he mentioned in his video is researchers have started a campaign called No Science, No Future. What is that? We will explore more.
Next, we have Sandra Lopez-Verges from the Gorgas Memorial Institute for Health Studies, Panama. And she says, One Health, EcoHealth enables fights against the pandemic.
The next one is from UK, our ex-GYA member as well, Zakari Totally. So in his statement in the video, he mentioned about the lack of transparencies and consistencies from politicians is a great concern in UK. That's
another key concept that may be expanded more to understand how the different governments have tackled the situation. Next, we have Chirasree RoyChaudhuri from the Indian Institute of Engineering, Science and Technology, Shibpur. And with this key sentence, portable, low cost, and rapid detection sensing system for COVID-19 is key.
The next is from Niger. His name is Ibrahim Sidi Zakari. So his statement is mentioned about they have collectively analyzed the data to provide advice on evolution of the pandemic. Very interesting.
And then finally, we have Daniel Limonta from the University of Alberta, Canada. And he says something that is really important for us as young scientists. So this global crisis has been a unique opportunity to showcase the capacity of the scientific community. And this is another key concept that we will try to elaborate more to understand what we can practically do to work along with governments and policymakers to try to prevent the new pandemic will be arising. So we hope that these sentences were really inspiring to you as they were for us. And we will start welcoming questions to the panelists directly in the Zoom chat to Kirsten, so that we can then post them to our speakers today. But again, this is a launching session, so we will start to exploring what we can do in order to prevent that these really huge problems will happen again. But over the next 2 days, we really want your input in the Google document so that we can bring the discussion to the next level. And so I will start. We will start to have our panelists in the room. So dear all, if you're there, you can unmute yourself now so that we can start asking questions to you. Okay, we can keep it here. So the office is saying that Clarissa, are you here with us?
Hi, Velia. Yes, I'm here.
Okay, great. And then we should have also Chirasree, Ibrahim, Sandra, Daniel, and Larry Cheng.
Hello, everybody. It's Sandra.
Hi.
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 So how are you guys?
Yeah, very good. Nice to see that you're in Italy and going well.
Okay, that's great, and I hope that you are all safe in this time. Wibool, do we have some first questions?
Actually, not yet. Maybe we could start with our own questions first, in fact.
Okay, okay. Actually, I see that there are starting popping up from the audience. So maybe I can start with one question from the audience, and then I will pass to my own because I actually have many. I hope this won't scare you. So one question from the audience is from Vanessa. Actually, it's from the panelist from Spain. So maybe it's not a good time to ask this question because he's not here today. But we will keep this question for the next meeting. But then we have a question from Robert. And he's asking which countries have managed to include the humanities and social sciences into the COVID-19 response? And what role for these deep disciplines in the recovery? So I think this can be addressed to any of you. So whoever wants to start this discussion is very welcome.
Okay, if you want, I can talk a little about the social science and this response. So, for example, in our country and most of Latin American country, when they asked scientific expert at the beginning, they focuses only on expert on global health or on virology, immunology, or really specific science that will have direct relation with the outbreak itself. However, we have seen now that the outbreak is taking a longer time, and that we're asking people for lockdown for more time, and at the same time we're having a lot of problems. because maybe first the science communication was not strong enough to really explain the population in simple words why we were asking them so difficult things. Second, there was in this communication, there was no social science that could analyze how the different part of the population, depending on education, on a social condition, on economic condition, will respond to what was asked and will respond to the different problems during the outbreak. So these have been that we have passed of the first month. There was message everywhere for the heroes against the COVID. And now, because the virus is now in the most populous neighborhood where people are in more difficulties and it's almost impossible to have a real isolation in your own home, the number of cases are increasing really fast. The economic is down, so there's a big pressure, so they're open everything anyway. And we have seen that there's a big distrust. So there was a big trust at the beginning, and now there's a big distrust against the government. And this is one big part because lack of good communication, because they didn't understood the importance of having social science since the beginning. It was lack of modeling of what could happen, taking in account social science. So we were doing modeling of how the virus will behave. We never did modeling of how people could behave, and if this was being good or bad for virus control. And this is really important. And I think the third thing is because they didn't take in account this, because we're also in Latin America, so we have some little problems of corruption. They were not giving the money to the people. So here, half of the population live on the day by day. So you cannot ask people to lock down like in Europe if you don't have something to eat for your family every day. So first, this is impossible. You cannot ask it if some part of the countries do not have water. So you cannot ask if in some part of the country there's really low education, so they don't understand how risky is the virus. They don't understand percentage. They don't understand risk. So I think this is where social science are really important at all levels: sociologists, psychologists, anthropologists, and specialists on communication and on health communication. So I hope we will learn about that, and the other countries too. And I hope we will be able to control, because now it's not in control.
Right. Yeah, you have touched several like sensitive points that relates to COVID-19 spreading, including the distrust. But I don't know in your countries, but for example, we experience a strong distrust also with the scientists. And this distrust was kind of emerging even more, because we also experienced a first phase where we needed someone that was understanding what was going on with this pandemic, to give some answers to people and to public. But then, since it was something completely new also for scientists and for virologists, this answer wouldn't be clear or wouldn't be definitive, which is something that we as scientists know very well. That answer is not always yes and no, especially if you're studying something new. But then when this comes to people, they believe that that scientists have just other interests, or they do not understand enough, or and so this kind of increases this distrust. So what do you think we could do as young scientists to build this bridge back with public? And how can we actually effectively convey the message that we often don't have very yes and no answers, but this is still a process of creating knowledge without losing their trust too. So Clarissa, maybe you want to give us some insights?
Hi, Velia. Well, there is a very interesting working group within the Global Young Academy, which is called Building Trust in Young Scientists. And I think one of the things we discussed at some point is that science needs to become even more transparent. We have to explain how the scientific method is and what are the pitfalls that we have within the scientific methods and how the peer review process is working at the moment. We also have to understand that we are all humans, and human beings sometimes make mistakes, and that's also part of the scientific life that we have to live in. And we have to, of course, be vigilant to pick up what are those errors. And the scientific method is created for that, to refine it and reduce this type of mistakes that we can have during the process. And I think that that's something that that citizens and policymakers are not very aware of at the moment. And I think that the way how we can, the solutions that we can propose has to be in a holistic way. In one way, we have to reform how promotions and how grants are given to scientists. So there we can have some parts that they give points to scientists that engage on webinars, that write blogs, that engage with journalists, with policymakers, and this can be also some successful ways to engage or use science for contributing to other areas. And this will promote that more scientists take time to gather the skills to communicate with policymakers, to gather the skills to write articles that can be digested by people in different fields, for example. And of course, it also, I think this new age of initiatives come from young scientists. I see many of my colleagues having TikToks and having Instagram pages where they explain their articles, or they explain scientific parts of what's happening at the moment. And I think these are really, really good ways. Other way could also be to engage journalists with scientists more often, so they can have communication that is continuous and that is always helping each other in order to communicate to society what's happening and what are the newest developments or newest technologies.
Good. So I have a few more questions from the panelists. Oh, you want to add, Sandra? Can we limit the answer to be a few minutes so that we can actually allow other panelists to talk to? But I will go back to Sandra. Yes, please, go ahead. Sandra? You want to say something?
It was really, yes, only really fast. I think, as Clarissa said, this is a moment to use for increase our science communication and explain how science works. And this is really important because, as you know, we're asking more and more scientists to help in science advice. So science expert group here, they did a great job on science advice, but because they use it as a figure during the government TV every night, and things went out of control because more of politics than of science, there was a total distrust of the population because they mixed the scientists with the politics, because they don't still understand science advice. They think we have all the solutions. And this is really bad, because it's difficult to have scientists interested in science advice. And with this, we have scared the few that are interested. So we need to use this time to gain the trust to science communication, so people will feel safe for science advice. Because when I say there was an attack, the attack was really horrible. It was even on personal things, because we're a small country, so, you know, the smallest the things more complicated. So I think this is important, that we really need to explain every time we talk how science works, when we're doing advice and when we're doing science communication. And we have to really say when we're not experts and give other names experts, and when it's normal that we don't know. Because humans in general, especially if they don't know science and they don't have been educated in a critical knowledge, they're really scared of not knowing. So if they don't know, they want you to know because they want you to protect you. We're in a really paternalist society. So this is really important that all scientists around the world work on this, but maybe some areas of regions of the world, the work is harder because education is lower and science is less well known, but they have contact to media and to anti-science movements. So this mix is really kind of scary.
Actually, I have a question that relates to what Sandra has just said. So because I find common traits in developing and developed countries on the problems that are arising with this pandemic. So do we think that the richest country have really there's really more knowledge about science and therefore more trust? Because that's not what I feel is really happening all around the world. That's a kind of provoking question, but that's maybe something that we can bring to Daniel. So what's your experience since you are in Canada? If you are there. Or maybe not. So maybe we can wait because it's very early over there. So maybe Wibool, you have some other questions from the audience?
Yeah. So relating to the trust in science and science communication, I think just a general comments that, I mean, everyone here, I think we are young and we so energetic. I think there's no argument about that. As a scientist, good citizen, we have to be involved in spreading the good science to all the publics, okay? Because you probably heard about the cognitive bias, right? Meaning that people will have predetermined judgment already before even they listen to the scientific fact. They will judge toward their, let's say, background, their connotation, their something which is something not really science. But with that, we have no excuse at all as a scientist to go into those channels and try to explain whatever we can to get them educated. And with that, actually, I have some follow-up questions actually posing from some of the our speakers here. I'm not sure whether it's still related because we are not really post-COVID-19 yet, but let's assume that if we are doing post-COVID scenario and there are some opportunity for scientists like us in developing country to develop technologies or actually help mitigating the problem or not. I mean, for example, I know there are some people in developed world that develop technology, but what about technology in developing worlds? Maybe we could go to one of our panelists from India. Chirasree, right? Are you still there?
Mm-hmm.
So please help explain to us, I know we are in a developing nation here, like Thailand or in India here. How could your technology could help enable actually advance the the diagnostic system here? Just briefly, just keep them period.
Yeah. Could you please repeat the question?
Oh, I'm talking about the technology that you help develop to enable the advanced diagnosis here. Could you help explain to us that's an opportunity for helping with even during the COVID-19 session or even post-COVID there, right? Just give us maybe a 1 or 2 minutes explanation. How did you do it?
Okay. So these are basically electrical type of sensors, which are really portable, where if you just insert the sample and press certain keys on the system, it will show you the results. Now, how we are achieving the sensitivity, it's primarily due to some pulse sort of a technique where a lot of virus molecules can be captured even from very low sample volumes. And the specificity is given by the antibodies which the microbiologists typically develop. Also, for post-COVID-19 era, such sort of devices can be used for further any detection of any further such pathogenic outbreak if it occurs later in future. Because the principle of this platform is can be widely applied for detection of various pathogens and virus. So we can also apply it for post-COVID-19 era. Not only it is specific for COVID-19. And since it is electrical, it is very much portable in nature and low cost also, affordable.
This is very intriguing. I really admiring people from actually developing nation who help us, enable this detection technology, right? Especially you, Sandra. You're also doing the all the lineage, right? Finding all the strain of these viruses, right? That's what we listened from the videos, which is pretty awesome. Because I know all the strains have different virulence and efficacy that you have to do the treatment. Any question from Velia, or I could read some more questions from the audience as well.
I have many questions, but I will leave it to the audience.
Let's hold our question off. Let's read the question from the audience. Okay, there's one more question from. Okay, let me see here. Oh, all right. Oh, they have removed the question. Oh no. Okay, Beatus. Okay, ask this question. Do panelists think that international scientific cooperation has increased during this pandemic or not? And what are the challenges to those type of cooperation that they would actually wish to solve? All right, two questions here. The cooperation increased or not, and challenges or type of cooperation that existing. Are there, maybe we will allow some of the other speaker to say first. Ibrahim? Are you still there? You unmute? Okay, let me unmute you first. Sorry, you forgot to unmute. Ibrahim, wait. Ibrahim, okay, all right.
Thank you, and we will. Good morning, everyone, and it's my pleasure to join the discussion. Okay, regarding the question of Beate, for me, regarding my little experience, since just in Niger we have experienced the first case on 19th of March. And in terms of collaboration, for example, it's allow me, for example, to collaborate with other scientists from the United States on two major projects. For example, with Tyron from United States on a chatbot, information chatbot. And the second project was related to Facebook data for good initiative with one researcher also in biostatistics from the United States. So just to give you an idea about which kind of collaboration, international collaboration, these I have set up during the pandemic. And also in terms maybe.
Sorry, Ibrahim. I think
challenges. I will say so. Can you hear me?
Yeah, it's a bit slow, so probably if you stop the video, the connection should work better. Can we try that out?
Okay, I will. Okay, now maybe it's good now, yeah?
Yeah, actually now it's much better.
Okay, great. So I'm saying that, for example, regarding the challenges, for example, we are facing, we have, for example, the ethical aspect and also the privacy. Since you are dealing with data, sometimes you see it's personal data. You are not allowed. And for instance, for in the case of Facebook data for good initiative, they are targeting only research institutions. And if you are, for example, you have responsibility with government offices, or you have a position within the government or any other public institution, you are not allowed, for example, to use this kind of data. So just to give you some kind of challenges from the statistical or modeling point of view.
I see. Any other speaker want to, panelists want to add on this same question here? Clarissa or Daniel? Daniel, you haven't talked yet. Are you still there?
Daniel has audio problems.
Oh, I see.
So he's there, but he cannot really speak for now.
Uh-huh.
So,
hi, Wibool.
Yeah, Clarissa, you want to just add maybe a few more sentences, 1 or 2 minutes?
Yes. So just to show one example is that the moment that the sequencing of the virus was discovered in China, they immediately upload this information, and this was shared by all the scientific community around the world. And that was the first genome sequences that have been used to study structure, to study what is the conformation of the spikes, and so on. So I think that's one of the examples that we can use to show like how the scientific community really gets together, shares information in an open way, and can be used for further experiments and investigation. I think like within the challenges that I foresee happening in the future, maybe will be that not all publications are open access, and then not all the information can be easily accessed by, for example, developing countries. And also talking about this open access system, I can also mention that it's very expensive to publish an article in open access. For example, one of them is $2,500. And I think that that's also money or funding that is not included in some grants, for example, in developing countries. So that makes also a little bit difficult to publish in that way, and to make science open and promote scientific collaboration internationally in a big way. Thank you, Wibool.
true. We have one question that is for Larry. And the question is about the technology that you're working on. So what vital sign can be monitored using wearable technologies for detecting COVID-19? What will be the specificity of these tests?
I don't think he's on, Velia.
Oh, he was listed as on, actually. Okay, never mind. We will move to the next question.
The next one.
But he is in the room because I saw him before. Yeah.
Okay, all right. So maybe we come back to revisit this question again. But yeah, let's go to the next question here. So another question from the audience as well. Moni, our GYA member. Can I read out the question? It's pretty long, actually. Okay, so the question is like this. How can we tackle the leadership crisis to tackle the post-COVID disaster we're going to be faced? As everyone knows, this is probably not going to be the first pandemic that we're going to suffer in this era, right? And so he asks about the leadership crisis that we have in some countries. Not all countries has this crisis here. Any panelists want to tackle on these questions? Sandra, you look like you want to speak something.
That's what I want.
Oops. Sandra, sorry.
Yeah, sorry. I was asking, can you ask the question again? Sorry.
Sure. So the world has enough technical knowledge to tackle this COVID-19 pandemic, let's say, right? Instead of these many resourceful countries, we're talking about, I don't want to mention any other countries, but probably know on the news already that they have far more resources than developing nation combined, but they still fail to handle this pandemic crisis. So the question is, how do we tackle this leadership crisis and to tackle this post-COVID disaster that we have already faced now, or maybe for the next one preparation? So how we do that? It is a very difficult question to answer, but let's imagine that you are the world leaders and see what you would do, right? You can order somebody out.
I think first the leaders need to understand the complexity of all the problems and need to really want to solve them, because it will depend what are the goals. And I think the problem is that I don't think the goals of most leaders is to solve the problems of the world. If they really have this goal and they will really have a big discussion of different problems and use some solutions that already exist, we will be really going, you know, forward. I think the problem is that currently the leaders, they're for power and work and money, you know, and I think we all know that. And that's why there's a big distrust of the populations to their leaders. And that's why even when the leaders are giving good advice, population are not hearing them because they don't trust them anymore. So we really need to work all together, and we really need again to have the knowledge, but also the communication skill and the social sciences to gain the trust of all the population at the same time, and try to, I think we all need to sit down and think what we want as a global society. Because we're thinking global and we're here at Global Academy. But COVID have shown, I think, the best and the worst of humanity, because a lot of countries and people did not behave as thinking of others. Most of the countries closed to themselves, not to protect themselves, but not to allow other people to have their resources and not to help the other people. We have seen that a lot of bad communication have, like people have think that this disease comes from specific people. You know, it has been used for racism. It has been used for a lot of, you know, problems. So I think if we want to tackle the problems, and this is where sometimes I think the problem is not the technology, the problem is not the knowledge, the problem is how to use them and why you use them, and for whom and for what. And I think this is really important, because I think we're going forward on getting new technologies and knowledge, but now we really have to use them for the best. So we really need to fight inequity, and we need to fight this kind of natural egoism of protection. So we really work all together and we take the knowledge of all together, and I think we can do amazing things. But we need to have more GYAs at all the levels, and not only between young scientists, but, you know, between countries and generations, and between politics and economics and us. I think the problem is we still think progress is economic of consumption and increase of, you know, funds without good use of it, that we will always have a problem. I think that if we don't give the priority to people and we give the priority to money or other things, we won't have the solution. So we really need to all think together. And I think this is a kind of discussion that I'm not sure everybody wants us to have.
That's great, Sandra. I'd like to actually give this problem to Clarissa and see whether she has any take on it.
Yes, I think that adding to Sandra, I will also like to raise the question to the audience if this is really a political problem, because scientists have been talking about the next pandemic. They have been showing the data. Even the director of my center has a TED talk years ago saying what are the systems that are going to collapse in the next pandemic. So maybe it's a lack of long-term vision from policymakers and from citizens, because at the end of the day, policymakers have to have an agenda, and I think that agenda can be pushed by citizens. So I think that we have to think about in a holistic way again. Do we need to communicate science better to citizens, so citizens can be the ones pushing the agenda for policymakers to think about long-term and think about the risks and the events that may come later? If that's the real problem, if politically appealing, you know, thinking about the future and the risks that can come is not politically appealing, as I said. So we have to find a way how to find solutions for that. So do we need to reform the UN? Do we need to reform our universities? That's the question that we also need to have in our minds.
I guess that dissect very well to the global statement that we actually, as a GYA, putting out, right? You still remember the publication in March, right? The direct declaration that we have for COVID-19. That's show the unity of us as a young scientist to actually help fight these global pandemics here. Actually, that's one of the questions of from the audience as well. How do you feel about that declaration here? Maybe I could ask some other people who hasn't pitched in yet. Ibrahim or Chirasree, do you want to pitch on that declaration? How do you feel, and what do you think it is useful, or how are we going to make this effective? That we already swear, right? Not in blood, but what should we do with that? Microphone, Ibrahim.
So I think it's a good initiative, for example, having this kind of statement, because you see it's this point of view from scientists is very important. For example, I will give you maybe some experience from Niger and from neighboring countries, for example, in West Africa, where this kind of collaboration with scientists have improved the management of the situation. For example, each week we have a kind of meeting between scientists and the government before the official communication, the official weekly communication of the government about the pandemic evolution, for example. And I think the statement or the point of view or the scientific contribution of scientists is contributing to improve or to build stress about what the government is currently doing, because the citizens feel like the government is trying to involve many people, including, and also the decisions are based on scientific advice as well as evidence based. So it's very important, this aspect, particularly when you have, for example, some countries who open the borders while, for example, some other countries have closed their borders. So you need to try to explain and maybe to convince people why, for example, for your government, it's very important, for example, to take this decision, which is not maybe the same case in another country. This is one point. And also the second point, how to explain, for example, to citizens that some countries are trying to perform a lot of tests, COVID-19 tests, while other countries are trying to limit or to use very limited tests. You see, at this point, you need to convince them this position, for example, for your country, take this position and assume this position, for example, not conducting a lot of tests because you have this fact, this aspect, or I don't know, some socio-economical realities which are behind the decision they have made. So I think this is a very good point. And at the end of the day, I think for the majority of countries, the government have seen the importance, for example, of scientists. Thank you.
Okay.
No.
So we have around 4 minutes left. I would like to maybe read out one last question before we wrap up the session. So this question is about the mental issues during this crisis. So who tackle mental health issues and policy research now, and what are good examples of the solutions? Are there any of the panelists have experienced this kind of questions before? Let me try to read out one more time. Mental health issues, policy and research. Sandra, you look like you have something.
No, I think now the mental issues in the population due to COVID is really big. So for the first time, I think we're really paying attention to the importance of mental health. And I think there will be two aspects of them. One aspect will be the mental health of the population due to the lockdown and to the stress of, of living this kind of crisis situation. And the other is the mental health of the people working on COVID. Because I cannot tell you, we're really stressed out. We're really exhausted. So this is really important because I had to ask 2 weeks ago, for example, for every morning, 2 to 5 people of my lab are going to mental health and work health because they were too stressed out and too exhausted because, yes, we're not sleeping since March. We see the numbers increasing up. We see the difficulties to have reagents. We see that people don't understand and are going out more. So we know the cases will increase more. And this, all this, you're thinking of it every day. So I think these two issues are really important, and I think they will work together. I know that there's now some grants specific on mental health, trying to analyze what are really the problems and how to help them. And the third issue, and I think this one is really important because it's the future, is the mental health of kids. Mm-hmm. So the lockdown have had effect on kids. And I have seen it, for example, my daughter's here, and they are in a house with a garden. So I cannot even think the mental health effect of kids that are locked down in a small space. And this is something that we really need to think because we don't know what will be the effect of in the future and how long. So this is really important issues that experts.
I guess we could come back to some of discussion, including the mental issues again. But for the interest of time, I think Velia and I are gonna try to wrap up now. Just to give you the prelude, these are some of the samples of the questions that we're gonna go live on July the 2nd again, and hopefully you guys have a chance to see all the videos that we post on the website. Go back to you, Velia. Is there anything to add? We have exactly around 1 minute 30 seconds before we close the session.
No, I think you have said it all. It was a great start for the discussion. We have still many questions from the audience that we will try to address on July 2nd. So the next session will be July 2nd at noon UTC. Meanwhile, we really want you to provide your input and even more questions in the Google document so that we can have a productive and fruitful discussion on the 2nd of July. And with this, I really thank all the panelists, the one that were here, the one that could not speak, and the one that couldn't make it for today. And we thank also you all for asking so many questions. And we are sure we are going to make some good action upon this discussion as members of GYA. Thank you very much.
Thank you very much, you all. See you again on July 2nd. Please watch the video. Bye-bye. Live from Bangkok.
Thank you. Bye-bye.
Bye.
Thank you so much for moderating. Bye.
Yes, thank you all. Bye.
Thank you.
Good day.
Bye-bye. It was interesting. Bye-bye.
Bye-bye.
Great job, guys. It was fantastic.
Hi, Michael. You're late.
Well, better late than never.
So yeah, so we just finished. Maybe we have some wrap up after this, after all the audience left the room.
The people seemed super enthusiastic, so whatever happened must have been good.
Yeah, we really got so many questions and also comments that would be good to address. For,
yeah, I was dying to join an hour earlier, but simply there was a meeting, and I snuck out of it. Actually,
we forgive you. We forgive you. For today, for the next session.
For today, exactly.
You can't be there. You are the co-chair. You're supposed to be there, okay? And where is Initiative?
Actually, I do enjoy these meetings as well. So I think. But anyways, we all, unfortunately, everybody knows how to use Zoom now.
Hey, Moni, are you still there? Wow. Okay. Thank you for great question. Yeah, I asked some of your questions. Join us again on July 2nd.
Okay, so maybe we can leave this meeting here.
You want to do that? Okay, and we can start another one. Yeah. All right. Let's do that.
Bye again.
Bye. Bye. Bye.
Guys, see you then. Bye. Bye. Bye.
It's a good host. We have to send them
Well
off.
done,
Right?
team.
We have to send them off like Japanese style, right? Yeah. Yes.
So we need to wait for everybody else to leave.
Good to leave, yeah. Send kind of a good host be like, yeah. We
That's
cannot
true,
just...
very true. Actually, sometimes it happened in the past that when people were my hosts, were my guests, at some point I would get so tired that I would go sleep and leave in there having their own fun. that really happened. I trust my friends.
True. I think some of the participants thought, why this is so short? They're still there actually. I think they're like, they want more, but yeah, let's save it for July 2nd.
Yeah.
So we'll do some wrap up after this. So I hope all the product teams are there. Actually, there's a Kristen. We can
She's here.
them all out, right? We can get them all out now, right? Just
Yes.
Can we do that?
I'll be back in a second.
Can we do that, right? I think.
Can do that. And see you soon.
Hi, Bala. Yeah.
I'll close the room and just rejoin.
Okay.
Oh, really?
Okay.
This the same one? The same one? Or?
Yes.
All of us. Okay.
Okay.
Okay. All right.